Good morning everyone. Today I will be speaking on role of parental smoking in myopia, a systematic review. Slide is not changing. With current myopia epidemic ongoing, we know that by 2015, half of the world population will become myopic. Parental smoking has been shown to be associated with refractive error, and literature shows mixed effect on development of myopia. So this systematic review evaluates the current evidence on the role of parental smoking in childhood myopia. This protocol was registered on Prospero, and search was done across 3 databases, that is Scopus, PubMed and Web of Science. Search strategy was designed using appropriate Boolean operators and using the following keywords: parental smoking, maternal smoking, paternal smoking, myopia, children, offspring and risk factors. The studies which had children under the age of 18 years and association with parental smoking were studied were included in this review. PRISMA 2020 guidelines were used and risk of bias was assessed using Newcastle-Ottawa scale. This is the PRISMA flow diagram showing initially 91 studies were retrieved from 3 databases, and after removing the duplicates, the records were screened and 33 records were excluded based on the inclusion and exclusion criteria from the abstracts. Then full texts were retrieved, and finally 16 studies were included in this systematic review. The data extraction was done on an Excel format using the predefined criteria. That is the demographic characteristics of the patient, exposure pattern, what is the duration of the smoking, what type of smoking was being studied, myopia diagnosis, confounding factors, whether they were adjusted or not, what was the study results, and the study quality. Now coming to the results, the sample size of the studies varied from 300 to over 12,000 children. The studies were mainly based in China, Hong Kong, Singapore, UK and United States. Out of this, 12 were cross-sectional studies and 4 were longitudinal cohort studies. The spherical equivalent which was taken in these studies as a marker of myopia was less than or equal to -0.5 diopters, and 11 studies did cycloplegic refraction on children, and 5 studies had non-cycloplegic refraction. All studies, 16 studies adjusted for common confounders, that is the age, gender, parental education, socioeconomic status and parental myopia. The exposure was collected through a self-reported questionnaires in which the parents told about their smoking habits. Biomarker validation method in terms of measurement of urinary creatinine was done in only 5 studies. The various measures of smoking were reported in these studies, like current smoking patterns, what was the maternal smoking during pregnancy, and household smoking frequency. 10 studies identified protective association with lower myopia prevalence and higher hypermetropia prevalence in the children of smokers. 6 studies reported that second-hand smoke exposure is linked to greater axial length, and it was shown in some studies that higher daily cigarette count demonstrate a higher risk of severe myopia. The risk of bias was assessed by Newcastle-Ottawa scale, and out of these 9 studies had high quality, 5 had moderate quality and 2 were of low quality. So the limitation of evidence which we found out, the existing evidence were the self-reported parental smoking habits which could introduce a recall bias, and incorporation of biomarker validation methods, that is by measurement of urinary creatinine, was not universally done. Cross-sectional design of 12 studies, it limits the establishment of causality, and only 4 studies were longitudinal cohort design, which are more suitable for causal inference. The limitations of current review were we excluded the non-English studies, so language bias was introduced, and we relied on electronic databases. Unpublished studies were not included in this review, which could have led to publication bias. And there was a variability in exposure measurements and outcome, which led to heterogeneity in the studies, and it could not be fully accounted for in data synthesis. So to conclude, this systematic review provides an in-depth analysis of association between parental smoking and childhood myopia. While findings indicate a potential link, the evidence remains mixed, highlighting the needs for further research using longitudinal study design and standardized diagnostic criteria. And public health policy should be made to educate the Now, population about the risk of smoking, which can have adverse effect on the ocular health of children. Thank you.
Very interesting.
It was a nice study, but you didn't show the forest plot.
Ma'am, forest plot meta-analysis we did not do. And
You didn't do the meta-analysis on this?
No.
Okay.
But your study was, the pattern was a meta-analysis, no?
Yes, yes. the
But
pattern was
because
of meta-analysis.
heterogeneity was more and the study design also differed, so we did not do.
Even in a high heterogeneity, you can do a
Yes, ma'am.
meta-analysis
Yes,
using the
ma'am, but
random effects model.
in this we do not do that.
Okay.
ma'am.